More than a third of adults in their 50s have diverticulosis, which can lead to painful flare-ups called diverticulitis. Today, Dr. Shiv Dattani, one of Idaho's top colon and rectal surgeons, joins us to share what causes it, how to prevent it, and when surgery might be needed. So great to have you here.
Thanks for having me back.
Okay, yes, so diverticulitis, what is it? I think it's a term that many of us have heard, but help us understand it.
Well, so there's one really important point. So one, diverticulosis is just having pockets, and about 50% of people in this country over age 50 have the pockets or diverticuli. Diverticulitis is when these pockets get infected. So the colon is roughly 6 feet in size, it's that long. The lower colon, called the sigmoid colon, is a common place for diverticuli due to pressure. And these pockets can get impacted or inflamed. They can lead to flare-ups called diverticulitis.
Okay, and so we're talking about pockets within the large intestine.
Correct.
Okay, what are some symptoms that somebody might have diverticulitis?
Okay, so it's first helpful to distinguish that with diverticulosis, a lot of people have no symptoms at all, and a lot of people have these pockets. Now, if someone is having an active flare-up called diverticulitis, they may develop left lower quadrant pain. They may develop bloating, they may develop fevers, they may develop change to their bowel movements like constipation, diarrhea. It's very important that if patients have persistent pain or something that's worsening to go seek help.
Okay, and are these like quick onset symptoms? Are they gradual, or is it both?
Excellent question. So for every patient, the way they present can be slightly different. Some people may have something that just catches them by surprise with severe pain. Others maybe have something that's been grumbling and it's getting worse, and they've been kind of pushing it off, and it's at a boiling point in which they go and seek help. So everyone can present slightly different.
Okay, and then who typically is more impacted by this?
Well, it's so early on, it's usually men more than females, and over age 50, we see female predominant. But really, a lot of people have diverticuli, and they may develop diverticulitis. We do see some clustering in families, so some of it's genetic, but usually it's those that are, anything that leads to not a healthy lifestyle. So smokers, people that drink, people that eat or processed food or have too much red meat in their diet. Those are people that tend to develop these problems.
Can previous illnesses too possibly lead to this? Like if you have a certain disease, or maybe you already have a predisposed issue within your gut?
Well, so for some patients, so we see them with connective tissue diseases amongst some other heart or blood vessel conditions, but mostly it's something that is limited to Western countries actually. So we don't see these all across the world. It's limited to Western countries, especially with severe episodes.
That's fascinating.
Yeah.
Okay, so again, that diet.
Exactly, yeah. Processed
incredibly
foods.
Important.
Yeah.
Okay, which leads me to ask, how do people prevent flare-ups then, if they're
So the best way to prevent flare-ups is living a healthy lifestyle, as I mentioned. So exercise, limiting alcohol intake, limiting red meat intake. Smoking obviously is harmful for many different illnesses, but definitely related to diverticulitis, as well as reducing alcohol consumption.
Okay.
There are some things you can't change, so there's genetic predisposition for some patients. But the big thing is increasing water, increasing fiber intake is best to help patients maintain a healthy colon.
So lifestyle.
Lifestyle.
All comes down to lifestyle. Okay. And at what point, though, would somebody possibly need surgery for diverticulitis?
Well, so being a surgeon, I feel not biased at all. Like I'm trying to avoid surgery at all costs.
Yeah.
I only try to offer surgery when it's absolutely indicated. And we have very strict guidelines on when to offer patients surgery. Now, with surgical decision-making, we take into the patient's factors and how they feel into effect as well. There was a really important study that came out in the last few years which reviewed GI quality of life scores. So a scoring system that patients tell us how they're feeling, and they also revealed surgical outcomes with surgery versus no surgery. So I explain that to patients when I see them in the clinic for people with maybe milder symptoms more frequently. And we talk about surgical decision-making shared, with each other. Then there's other patients that may not be able to avoid surgery. So diverticulitis is broken down into 3. So the people with more complex episodes with an abscess or perforation or a narrowing in their colon, those are people that definitely should be offered surgery because they may develop a severe complication. Some people develop fistulas where the colon gets very inflamed. It can stick to surrounding organs like the bladder, and those patients would definitely benefit from surgery. So it's case-by-case basis, and I really enjoy meeting these patients, talking to them to see if they can avoid surgery, making sure their colonoscopy is up to date, because about 11% of times we're actually fooled that it's not diverticulitis. It could be something else, like colon cancer. So it's important to have screening, but also
Hence,
talking
like
to them.
colonoscopy, other ways to make sure that you're looking at
Yes.
the colon closely to
Yes.
see what other things.
Yeah, and to confirm the diagnosis as well.
And let's talk about the surgery itself, though. Robotics plays
Yes.
a huge role because that's what you utilize. Tell us about
Exactly. So robotic surgery, I feel very strongly is the future. It's something we're doing presently as well, but it helps aid with better visualization. So the camera is 4K, 3D. I have 2 left arms, 1 right arm, and I have really small incisions I operate through. Patients recover very quickly. They have minimal pain. They're up, walking, and eating the day of surgery. They're usually in hospital a lot less and back to doing things that they really enjoy within a few days after surgery. The precision is fantastic. Avoiding injury to nerves or blood vessels is just, it doesn't compare to any other technology we have. So patients we find do very well.
That's fascinating. Okay, Dr. Tani, where can people go to learn more?
People can learn more at stalfonsis.org/diverticulitis.
And also scan the QR code right there on the screen. Dr. Tani, thank you so much.
Thanks for having me.